Record, share, boom, share. Boy. What happened? Eric, you are unmuted. Eric, you are unmuted. I'm trying to mute you, but it is not working. Okay, so you guys all see my screen, yes? Give me a little thumbs up reaction thingy. Okay, good. All right, so today, I guess I should have warned you, we're going to talk about types of injuries to this musculoskeletal system. So we're talking mostly, well, I guess not mostly at all. We're talking about bones and skin and muscles, okay? The next picture is going to have some hard to see pictures, but not terrible, okay? So these are the different types of injuries that we can have. These are all injuries. I guess they're not all injuries to our musculoskeletal system, but they're all soft tissue injuries, okay? So we have sprain and strains, contusion, fracture, blisters, burns, amputation, avulsion, dislocation, and subluxation, okay? Now, I would not write all of these down at this point, okay? We're going to go into some of them more specifically. If I talk about it on this slide, I would write it down for now because I won't talk about it again later, okay? Okay. So, contusions. Does anybody know what a contusion is commonly called?
A bruise.
A bruise. Good. Okay. So you could have a small, simple bruise, or you could get a much larger, diffuse bruise, or a bruise that is spread out over space. Okay. Why do we have so many colors? That is the blood, one, being broken down, and two, pooling in this area. That is what a bruise is. It is basically a limited internal bleeding. Yes, Angel, this is being recorded. Okay. Now you made me double check, but yes, it is. Okay. What is the common name for a fracture? Somebody usually doesn't say I fractured something. They say I did something else. What did they usually say they did?
Broke.
They broke it. Okay. So a fracture is a broken bone. Okay. A blister. Again, you could have some not so significant ones. These ones look gross, but that's just because they've had a Band-Aid on it for too long. Or you could get a pretty good size blister. Okay, this is probably from a burn to be that size on the hand. Okay, we will go over later throughout the course on how you would manage these types of situations, but I'm just going over the different types of injuries. Okay, a burn. This is actually a burn. Okay, this is probably a 2+, maybe a 3 when you get into these darker areas. Okay, but that's a burn. This is also a burn. Okay, if you've ever gone out in the sun for too long and you had a sunburn blister, that's a grade 2 burn. Okay, or a 2nd degree burn. So they can get fairly significant. Okay. We all know what an amputation is. That is the loss of a limb or part of a limb. An avulsion, sun poisoning is not really a medical thing. That's more of a common term than a medical thing. Okay. Avulsion is a chunk of skin being removed or a chunk of bone. Okay. And a dislocation and a subluxation. We will get into those in a minute. Okay. So sprain and strain. Okay. These are two different injuries that are very commonly confused together. A sprain is an injury to a ligament. A strain is to a tendon or a muscle. Okay, so those are two very different structures, but they are talked about. Sorry, somebody just came in. They are talked about almost interchangeably all the time in the media. It's because they don't understand the difference. Okay, so it is impossible to strain the ligaments in your ankle. That is a sprain. Okay, now you can have different grades or severities to those injuries. Okay, so the analogy or the way I like to give it to you guys is if I interlace my fingers like this. Okay, this is a tendon or a ligament or a muscle. Okay, a grade 1 sprain, we are going to stretch these fibers apart and we're going to get little micro tears. That's what the holes are here. Okay, so you're going to stretch them apart. You're not going to tear any of the fibers. Okay, a grade 2 then is we've gone a bit further with our stretch and we started to tear some fibers, but we still have some fibers intact. Okay, a grade 3 sprain or strain is a complete tear or a rupture of the tendon. Okay, so those are different grades to your sprains and strains. Okay, do not make the mistake of saying he strained his ligament. That is impossible to do. Okay, now a dislocation and a subluxation. Sorry, the quality of this picture is not very good. Okay, these two are very similar as well. A subluxation, some people would commonly call it a partial dislocation. But what has happened is, this is a hip joint. The hip is sliding out of socket, but then it comes right back in on its own. It does not get stuck out of place. On the other hand, a dislocation is when that joint gets moved so far out that it gets stuck. Okay, so when you see the guy with the picture of his hand and his fingers bent over sideways like this, that's a dislocation. Okay, I can subluxate my shoulder. If we were in class, I would let you feel me sublux my shoulder. Okay, I can slightly pull it out of place so that there's a bigger gap here in my shoulder, and then I can relax and let it come back into place. Okay, it's not a good idea to do that, but it's for education, so it's okay. Are there questions about sprains and strains or dislocations and subluxations? No. Okay. So today, here's where we're going to spend most of our time. Types of fractures. Go ahead and write these down, but leave a little bit of space between them because we're going to go into each one of them specifically. So I'll go ahead and give you a minute here to write this down. And I'm going to go close the door. I will be right back. Okay, give me a thumbs up reaction if you are good to go. Or when you are good to go, I should say.
What do you put a thumbs up?
I honestly don't know. That's a good question, Angel. It should
There's a
be like,
little bar at the bottom. When you hover your cursor and there's a reactions button, and it'll give you options for different emotes.
Man, I don't even have that option. Whoop, that's not what I wanted to do. Okay.
Yeah, I don't know.
Okay, so these are the different types of fractures. There's a lot of different ways that you can break your bone, okay? We're gonna go over the basics for each of them, and then we're gonna go into small breakout groups, and you're gonna do a little bit of a research assignment, okay? So the first one, avulsion, okay? An avulsion is when a tendon or ligament pulls a chunk of bone off, okay? So looking down here, this is the avulsion, okay? This is an ankle, this is the fibula, this is the tibia, and then you have a lot of bones down here. So you have the talus, you have the cuneiforms and the cuboid and the navicular and all kinds of stuff down here. That's why this looks really, really bright, okay? So what has happened is, why are you guys, some of you guys are getting kicked in and out and that's confusing me. Okay, so what's happening is this person is spraining their ankle. They are inverting their ankle and the ligament has pulled a chunk of the fibula off, okay? A stress fracture, okay? Oftentimes a stress fracture is really considered a stress reaction, okay? It's very common in the feet and lower legs. Why do you think that is? Somebody give me a reason.
Because all our weight is put on them.
Okay, good. Your weight's put on it. Repetitive stress. So every time you take a step, that is a repetitive stress, okay? If you have mechanical issues in your foot, be it that the padding of your foot is not very good, the toe alignment is not good, that can change the way all of that force is applied to your foot, and your foot can react, and we would see this type of a situation in the x-ray. You see nice, clean, clear edges on the bones over here, and then here we get this really fuzzy, bubbled look around the bone. That is a stress reaction or a stress fracture. Okay. Then you can get what's called a spiral fracture, and this is a torsional force, okay? So a torsional force is a twisting force. Think of a barber's ball outside the window that keeps rolling up, okay? Or a candy cane if you keep spinning it, okay? That's what's happening to the bone. You've twisted it and the fracture is wrapping its way around and up the bone, okay? Again, this is a lower leg, so you have the tibia and the fibula here, and this is a spiral fracture, okay? And the way we can tell that is by one, we have this view here, and you have this little piece back here, okay? We'll talk about this in a minute, but that's going to distinguish it from another type of fracture. Then when you look on the side here, you can kind of see that it's faded back in this region, and then it's crystal clear here that there's a fracture, okay? This is because it's getting covered by this piece of the bone and you're trying to see the fracture over here. But then once you see this side of it, it's nice and clear, okay? So there's a couple of ways to see a spiral fracture. A longitudinal fracture. So the fractures we've talked about so far have gone mostly across the bone. A longitudinal fracture is going to go the length of a bone or partially the length of a bone, okay? This is usually done from an impact. So if you land on a straight leg, that's one way to get this type of a fracture, okay? Or if you put your arm out, what is called foosh, fall on an outstretched hand, okay? That's another way to get a longitudinal fracture. Okay. RJ, do you know how to use the annotate tool on your side?
No.
If you go up to the top of your screen, you should have a little menu that drops down.
Wait. Where?
Where you would go to mute or turn your camera off.
Oh, yeah.
Okay. Then you should have like a view options, and you should be able to click that, and it should say annotate.
Yeah, I don't see it.
Let me see.
I don't have that option. I'm on my phone, so maybe a little different.
Okay. Does anybody know how to use the annotate option?
I think that's only available for you because you're the presenter.
I actually made it available to everybody. Ibuna, you're on there. I see you. Okay, so Abby, I want you to try to circle where the fracture is. Abby Ibuna, in this x-ray, circle where the fracture is.
Okay. What? Okay. I keep losing the little table at the top. I don't know why. I get it. Does that work?
Yeah, there you go. Good. Perfect. Yes.
Thank
Okay.
you.
So a compression fracture is when we squeeze the top and the bottom or the sides of a bone together and we squish it. Okay. So you can see here, these vertebrae are nice and full and thick. And then this vertebrae here is squeezed together and it has this fracture in it. Okay. That is called a compression fracture. Okay, so now I'm going to clear all drawings. There we go. Good. Okay. Now here's an oblique fracture. Okay. Oblique meaning angle. You're going across a bone but diagonally. Okay. So this is similar to a spiral fracture. However, it is going straight through. Okay. The spiral fracture is going to, again, wrap around this bone. Okay. Give you a minute here to write a note down or two. Comminuted. This is the most significant type of fracture. Okay. A comminuted fracture is any fracture that creates more than 3 pieces. Okay. So this is a mess. Again, this is the lower leg. This is the tibia and the fibula. Okay. The fibula has a simple, well, we haven't gotten there, but a simple transverse fracture. Okay. That one's easy. It's the tibia over here that is comminuted. You have at least 1, 2, 3, 4, 5, 6, 7 pieces of bone there. Okay. This is going to end up in a surgery. This person will probably have a rod put down the middle of their bone in order to keep it together. Okay. Thought I heard something for a question, but no. Okay. Okay. A green stick fracture. Okay. Usually this is common in kids because their bones are more pliable, but it's also called an incomplete fracture. This fracture does not go all the way through the bone. It goes about 3/4-ish of the way through here. Okay. This one, the outer cortex is still intact on both sides, but the middle piece of the bone is broken. Okay. Again, that's because their bones are more pliable or bendable. Okay. These are looking, this is a very strange x-ray now that I look at it. This is the hand. These are their metacarpals. They should have additional bones down here. I'm not sure if it's just covered up by skin and tissue from the splint here, but they're missing because you can kind of see little pieces here. So that's actually a very interesting x-ray. Okay. Transverse. This is the most simple fracture you can get. If you're going to break a bone, break it on a transverse plane. They simply line you up and cast you and you're done. Okay. This is the simplest form of fracture. Anybody guess what this is a fracture of?
The forearm or the ulna or something?
Which
Radius?
bone in the forearm?
The radius?
That would be the radius. Yes. Good job. We'll get to identifying them more and more later. Okay. Depression or depressed fracture. Okay.
Wait, you.
Yes.
Can you go back real quick?
Oh, sorry.
Okay.
There we go. Yeah.
Okay.
We're good?
Yeah.
Okay. A depressed fracture. And this is in the skull. Okay. This head is one shaped a little funny because it's got a weird angle out over here. Okay. But you can clearly see that there is a depression in the skull. Okay. Wait. So what has happened here is some heavy weight was dropped on the head. Okay. It could be that it was a younger person and it could have been a pound or two, or it could have been an adult and it took several pounds to do this. Okay. Cece, you're still, there you go. Okay. A blowout fracture. Okay. Blowout fractures are typically in the eye. Oh, it cut off my words. That's great. Okay. So what you are actually seeing here is a picture coming up through the jaw, through and out the top of the head if you're looking this way. Okay. Here's the normal eye socket. The bottom of the eye socket looks great. This is the fractured eye socket. Okay. This bone has now let the back of the eye sag a little bit. Okay. Typically with this, you will not see it in their eye. It won't be like their eye is all of a sudden falling back. Sorry, that was a very loud horn. But what will happen is there will be a muscle in the back of your eye that is responsible for looking up. So if you have this, you'll tell the person to look up and that muscle will get stuck and your one eye will track up, but the eye that's fractured will have to stay looking forward because the muscle is stuck on that fracture. Okay. It is actually a very interesting thing to see when a person has this happen.
Q, is there a way you can maybe move the picture of the x-ray so we can see what the words say?
Yes, give me 1 second. Okay, there we go.
Thank you.
Uh-huh. Okay. Pathological. Okay. What has happened is this person has some sort of disease, typically cancer, within the bone. That cancer has made the bone so weak that it is easier to fracture. Okay. Last year, I thought I was dealing with one of these, but it turned out that there was no pathology, which is very fortunate. Okay. It was just kind of a freak fracture. Okay. So what has happened is it takes very, very little force to break it because it's weakened from the inside out. We have one more fracture to get through, okay? I know I'm moving pretty quick here. Okay, last one. Apophyseal or epiphyseal fracture. Okay, this can only happen in kids. Reason being, it is a fracture through the growth plate. So once your growth plate's closed, you can no longer get an epiphyseal fracture. Okay? This is actually not broken. This is the growth plate. That is fine. This is the fracture here, and this is the fracture here because it is shifted. Can somebody tell me which bone this is that has the epiphyseal fracture? Any guesses?
Tibia.
Correct. It is the tibia. Good job, RJ. We've had a lot of x-rays of the tibia and fibula today. Okay. Are there questions on the different types of fractures, or does anybody want to see one of those slides again?
Did we go over blowout?
Yes. That was the one where I had to move the picture. Okay. All right. So here's what we're going to do. Okay. You're going to do a little mini research assignment. I'm not even going to call it a project. Okay. I'm trying to give you as much time that should be done within the amount of time you have left in class today. Okay. I'm going to put you into a breakout room. You are going to do the fracture number that you get. Okay, that's confusing. When you look down the list of fractures, if you're in room 1, you'll do the first one. Room 2, the second one. Does that make sense?
Yes.
Okay. So you are going to research these 4 questions and then find 3 pictures. Okay. You are going to see how does this fracture commonly happen. Okay. So for example, with the compression, we said it's squeezed. Okay. But how is that happening? Are they falling? Are they getting hit? What is happening? Okay. Is there an age group that this most commonly occurs in? What type of sport or sport would commonly see this type of fracture? So is it common in gymnastics to get a blowout fracture? No, is the answer. Okay, so what type of sports or what specific sports is it common in? And what is the care needed for that type of fracture? Is it going to require surgery? Are they going to need to be casted? For how long? Okay. And then you're going to find 3 pictures. I want you to find a picture of the x-ray, so like what you commonly saw already. The mechanism of injury. So if it's from falling, breaking their leg, then get a picture of somebody falling and breaking their leg. Okay. And then what it looks like after the injury. So if it's the dislocated finger, I don't want a picture of the x-ray. I want a picture of the person's actual finger with it dislocated. Okay. Does that make sense as to the different types of pictures you are looking for?
Mr. Q,
Yes, Sierra.
what would you say for like number 3 if you had like
Sorry, what is number 3? I forget what number 3 is.
what sport would you commonly
Oh,
do?
okay. Yeah, got it. Okay.
What would you say for that if you had like pathological?
You would say a common type of pathology that would cause it. That is a great question.
So you just wouldn't say anything about a sport?
No, because it's not really a sport related thing. It would take a little bit of a force from any sport to cause it. So what that's kind of a hard question for pathological. I see what you're saying there. I'll come talk to the pathological group for that one.
Okay.
Coach Q.
Yes, AJ.
Let's be on a Google Docs and we turn it in, or just like on our
Okay.
notebook?
So in Google Classroom, I have given you an example of how I want you to format group assignments for you to turn them in, okay? What you're going to do in your group, so one person is going to create a Google Doc and then share it with the other group members so that you're all working on the same document, okay? One person needs to turn it in for the entire group. I don't want 4 copies from 4 people, okay? Any other questions?
Yeah, wait, where's the link to it?
It should be in Google Classroom. Wait, hold on. Sorry, let me go back to sharing this. I want everybody to go ahead and take a picture of these questions so that you have them for your group and you know what you're doing. And then I'll check, AJ, I'll check Google Classroom to make sure it's there. And give you about 1 more minute to take a picture. Okay.
Hugh, where did you put the assignment? I don't see it.
Should be in Google Classroom. So what probably happened is I scheduled it and it might not have shown up yet. So give me 1 minute.
I didn't even see this link.
Yeah, it's not up yet. Give me 1 minute. Okay, so now go ahead and refresh your Google Classroom. It should be up now. Okay. There is no link or anything to any information. You guys are doing this on your own, okay? So I'm going to, assuming there's no more questions, I'm going to go ahead and create the groups. Okay. Are there any more questions? Okay. If you are put into group 3 for pathological, I'll come talk, or sorry. Let's see, it's number 12, group 12. I'll come talk to you guys for talking about question number 3. Okay. I will leave this meeting open so you guys can come back and ask questions if you need. This assignment is due, I think I put it for midnight tomorrow. Okay. Once you're done with this, you guys don't need to come back to the meeting. You are free to go for the day. Okay. All right, Jonah, Abigail.
Yes.
Abby.
Yeah.
Okay. So for your question number 3, you guys are pathological, right?
Yep.
So for your number 3, instead of doing what type of sport it would happen in, research the different the common diseases that would cause a pathological fracture. So other than just cancer, what kind of cancer, what other diseases would lead to this? Okay.
Got it.
Cool. All right. Thanks, guys.
Yep. Thank you.